Okay, so as we discussed earlier, based on your test results, you need an implantable cardiac defibrillator. So you require the surgery because you have certain risk of irregular heartbeats, which are called arrhythmias. So let me start explaining what an actual implantable cardiac defibrillator is, and it's a small device that is placed in your chest or abdomen, and it will help treat your irregular heartbeats, or the arrhythmias, and it will do that by using like electrical signals to help control these arrhythmias and to prevent hopefully future sudden cardiac arrest. So that's why it's needed and necessary. So if you need, I can go more in detail of how it actually works. Okay. So basically, the ICD has wires with electrodes, and these connect to different chambers in your heart, and they help maintain that steady rhythm that we want in a normal heart. So they carry the electrical signals from your heart to a small computer where the data is stored, and then I can take a look at that data later on. And the ICD, the computer monitors your actual rhythm, as I said, and don't worry, it'll be programmed and tailored to fit your specific heart needs and specific arrhythmias and the unique structure of your heart. So let's move on to the surgery itself. So the procedure itself, it's considered a minor surgery. It'll take a couple of hours, a few hours at tops, and it's considered. And you'll be given like medication right before the surgery to help you relax. It might even make you sleep, which is good if you're anxious about the surgery itself. And I will then apply like medication on the area where I plan to put the ICD, and that will numb the area so you won't feel a thing. And we'll first thread the ICD through the vein and help navigate it to the correct place in the heart where I intend the ICD to go. And what will help me with that is a X-ray movie, more like an X-ray movie. So it's like certain films of your heart going to help me thread the wire through, like without any complications, hopefully. And once the wire is in place, I'll make a small incision or a small cut, and I'll slip the ICD metal box through it, and it'll be just under your skin, and it won't cause like any discomfort or anything. The box itself will contain the battery, the pulse generator, and the computer, which will store all the data. I'll sew up the cut, and you're set to go. You'll be required to stay in the hospital 1 or 2 days just so we can keep an eye on you, make sure everything's going fine and as planned, and hopefully then discharge you. So, like with any surgery, there are risks involved. They're rare, but let me just run you through just in case. It can have some swelling or bruising in the area where the ICD is placed, sometimes even bleeding, but it's very rare. If something goes on during the surgery procedure, like blood vessel, heart, or nerve damage, it's a possibility, although again, very rare. A collapsed lung, also a rare side effect, and a bad reaction to the medication. So if we didn't test for allergies or something, you had bad to the relaxing medication we gave you earlier, that can cause like a bad negative reaction. Having an ICD does cause you to be at high risk for heart failure, but it is needed in your case to prevent sudden cardiac arrest in the future. So now let's say after the surgery, there are a few lifestyle changes that you need to alter. Um, First of all, let's say that the pulses, electric pulses, you won't be able to feel them. If you feel them, it'll be like a little flutter in your chest, like little heart butterflies, but nothing painful at all. So, like the lifestyle changes I was talking about may include, for example, you need to avoid close or prolonged exposure or contact with electrical devices or devices that emit like large magnetic fields. So some of these devices, like cell phones, try not to stay on your cell phone too long. It can like interact negatively with the ICD. Microwaves are another big one. Metal detectors, so in an airport, it's all just the corporate security that you have in ICD, and you'd rather prefer like a personal church rather than going through the metal detectors. Electrical generators is another one. Also, some medical procedures. So in the future, if you do have a need to get a medical procedure, you need to let your doctor know that you have an ICD, so no complications would arise, like using an MRI, for example, or electrocardiations. Those are big no-nos when you have an ICD. Some other things to consider: it won't limit your physical activities, so you'll be able to do sports, exercise, you'll be able to go on with your physical life perfectly. It won't affect it in any negative way whatsoever. However, like after the surgery, I recommend you don't drive for a week, just because we won't be sure like with the data if it's working properly. You wouldn't want to have like a sudden cardiac arrest or an arrhythmia or flutter that causes you to panic in the middle of the road while driving, which can cause an accident. And also, as your doctor, I will have to check your ICD regularly. So, let's say basically on average, I'd see the patient 4 times a year just to make sure everything's again working properly, no shorty wires, the battery is functioning properly, the data is being stored relevantly and correctly. The battery itself is like lasts up to 5 to 7 years, so you don't have to worry about that. And with our regular checks, I can maintain like monitor. The level of the battery, and then we can change it before it runs out. So that's something you don't have to worry about. And yeah, that's basically it. So hopefully surgery all goes well. Thank you.